My name is John Curran, Vice President of Advisory Services with the Burwood Group. In this role, I've helped oversee the development and evolution of our healthcare team into an organization that focuses on aligning healthcare technology investment to specific desired outcomes, whether those be safety, financial, clinical, regulatory, or otherwise. For the past 2 decades, the Burwood Group has assisted hospital organizations with their technology and IT needs in one form or another. Over the course of those almost 20 years, we've seen a lot of change in how IT departments are organized, run, etc. Clearly the biggest disruptor over the course of that time, specifically the last 10 to 15 years, has been the adoption of the electronic health record. What we're seeing coming now to the tail end of the meaningful use curve is that a lot of the promise or hope that maybe provider institution had invested in the EHR hasn't necessarily come to fruition. The EHR does what it says it will do, in that it takes a paper-based piece of data and makes it electronic. But it doesn't necessarily build into an organization automation or efficiency the way maybe some organizations had hoped. So CIOs find themselves caught in between trying to keep the lights on and deal with innovation. We know we've got to keep email flowing. We know there will be another regulatory target to hit, and those initiatives as run the business imperatives will always take precedent over some new innovative idea. But if we're spending all our time dealing with changes and maintenance to our existing systems, we'll be less suited to introduce that piece of cutting-edge medical technology that's going to make a difference in patient safety or outcomes. We're not going to figure out a way to actualize the benefit of what is now a massively connected patient population. So we know this sounds daunting. Everyone deals with constraints on their time and budget, and every organization has decision-making in silos. However, there are several steps you can take to solve for these challenges. We go into these in greater detail in our point of view paper. The main point we want you to take away from this paper is that the future of your healthcare organization's success will depend on automation. Automation requires technology. However, that technology and the way it's used must be aligned to the needs of your caregivers and patients. Once you shift to this mindset, you open the possibility to decrease your time to value and are able to spend more time where it matters in improving outcomes.